Good afternoon, everyone. This is Cindy, Cherry Creek Nursing Center. Once again, we're going to be talking about hand hygiene and what the CDC requirements are. Hand hygiene, you are sanitizing before you cross the threshold of that door as you enter. CDC guidelines immediately say, before touching the patient, you sanitize or hand hygiene. Before performing any aseptic task, clean task, dressing change, Foley catheter that will become sterile as soon as you begin to dive in, any invasive medical device you are working with, putting on their CPAP, after touching a patient, before moving from a soiled body area to a clean, after contact with blood, body, or any contaminated surfaces. These are core guidelines from the CDC. Sanitizing before you cross the threshold, sanitizing, washing 20 seconds, sanitizing 20 seconds before you do any procedure, touching the patient, putting on their CPAP, giving them medications. The list is endless. Nursing 101 for all departments. You must hand hygiene, our number one line of defense. You have to treat every person as if they have the worst disease known to man, no matter what it is. Sanitizing, 20 seconds. Washing your hands with soap and water vigorously, 20 seconds. This is critical. Must comply. The CDC, the state, Nursing 101 from our textbooks. Next topic, non-sterile dressings. You've just washed your hands. You have just sanitized for 20 seconds. Sanitize 20, hand washing 20. You are ready to begin. You will get you have checked the doctor's orders. You have gathered all of the supplies. Does the patient need to be medicated before you start the treatment? The treatment cart remains outside the door locked, ready to get anything if you have to change gloves, sanitize and change gloves. You've got your clean field set up. Cannot be paper towels. You have explained everything to the resident. You have got the resident scissors that have been signed out for this resident. They are clean with a hospital grade cleanser ready to begin. You have looked at the site. You have the exact size that you need going for this treatment. You have your little ruler with the 4x4. You are measuring length, width, depth if it is a pressure injury. Then you are completing the task. Then you provide proper hand hygiene after. Remember, the dressing must be dated and your initials. Then once you have completed all that, you've removed your gloves, you have sanitized, you have washed your hands for 20 seconds, then you make the resident comfortable and you document everything was done and call light in her hand. Okay, nurses, next topic, Foley catheters. Any line, suprapubic, Foley, PICC line, midline, G-tube, any ileostomy, colostomy, any invasive line in this resident, no matter what it is, must be assessed every shift. So let's specifically talk Foley catheters. If you have a resident that has a Foley for obstructive or neurogenic bladder, the Foley must be assessed every shift. What is the color of the urine? Is there sediment? Is there blood? Is there debris? Is it secured to their leg with a Velcro strap? Do you have orders? Bag is changed every 2 weeks. Catheter is changed per the CDC every 90 days or PRN if there is a problem. If the resident is refusing to allow you to assess the penis or the urethral area, must be documented. You must assess every shift. Is pericare and catheter care being completed every shift? Nurses, you're responsible that the CNA has carried out this procedure. G-tube. Is the stoma assessed? Yes, every shift. What is the feeding? The pump is cleared every shift. Colostomy, ileostomy, stoma must be assessed. CNA is only to empty the colostomy. Nurses, this is a treatment that you must change the wafer and assess the stoma. But critical, Foley catheters, suprapubics, assessed every shift. You must document. Hand hygiene, sanitizing before you touch the patient. Washing your hands after because you have handled body fluids. 20 seconds. This is critical. Thank you.